My name is Chalice, and today we are doing a career close-up with Dr. Akanksha Mehta. Dr. Mehta, how are you doing today?
I'm doing well, Chalice. Thanks for inviting me.
Dr. Mehta is a professor of urology and vice chair of education at Emory University School of Medicine, and she serves as director of male reproductive health at Emory Urology. Her clinical expertise includes andrology, male reproductive and sexual medicine, and microsurgery. She has been a member of ASRM since 2011 and is a three-time recipient of the ASRM Star Award. She is an SRMU member and chair of the Education Committee and has served as the director at large for the board of directors. Dr. Mehta, you have been very busy throughout your career. How does it feel to be at this point in your career today?
Yeah, it feels great. I think, you know, folks who are in the reproductive health space and who are members of ASRM, we have a lot on our plate at all times, but working with people who are all rowing in the same direction makes it really fun and really worthwhile to do the work that we do.
Good, I love that. Okay, so my first question is what initially drew you to the field of reproductive medicine, and did you envision your current role when you were at the beginning of your journey?
Yeah, so if you had asked me as a medical student whether I would end up in this field, I would have told you no, because I didn't even know that this field existed, right? I started medical school with the thought that I was going to become an infectious disease doc. And then I really loved surgery. And then I learned about urology, and I thought I was going to be a pediatric urologist. And I wasn't really exposed to male infertility, microsurgery, male reproductive and sexual health until I started my residency training. And I found this field to be so challenging and so academically stimulating, partly because of the surgical procedures. They were so precise, so planned out. And partly it was stimulating because of the problems that we were dealing with. I loved the fact that it was a very multi-specialty and collaborative field where you were often working with specialists from other fields to care for your patients. And there was a lot of room for research, and there remains a lot of room for research. There's so much that we don't know. So to me, the academic potential, the collaborative spirit, and the microsurgery really is what got me solidified in my decision to pursue, male infertility within urology broadly.
So, can you walk us through your career path and the key moments that shaped where you are today?
Yeah, so I did my residency training at Brown. One of my mentors was kind of a, let's see, how should I say this? Let me start over. So I did my residency training at Brown. One of my mentors was a leader in male reproductive health, Dr. Mark Sigmund, and really brought me into the field, introduced me to other leaders in the field, and got me excited about working in male reproductive health. I then went on to finish my fellowship at Cornell, again with multiple, leaders in the field. Many of them have been ASRM leaders as well, and it really helped me understand just the huge impact and scope of our field, and for the first time made me appreciate this very close and unique collaboration that we have as urologists with our REI colleagues. And then I moved to Atlanta, Georgia to start my first job at Emory, and I've been building my career here ever since. And really proud of the practice that we have built. And it has helped not only my career and my department of urology, but what we have been able to build as a multidisciplinary center has also helped my REI partners and the Department of OBGYN. So we have both, I think, grown a lot. Both sides have grown a lot from the partnership.
Yeah, that sounds incredible. It also sounds really special that you have been at the place where you started. You found a program and an environment and you can like at Emory and you stayed there. You said that was the first job that you
Yeah, it
came
was my
to.
first job. Emory is a very unique place in the sense that I knew when I started that I wanted to have an impact on clinical research as well and health services research. And my department allowed me to build that. I pursued a Master of Science degree in clinical research when I started here as like a young baby assistant professor and set up some collaborations for myself with the CDC. And those have really blossomed in terms of my research interests and my research career and helped me define, the key questions that I wanted to focus on as my research footprint grew. So organically, it was a wonderful place for me to not just start, but also build my career.
Absolutely. So for someone who is trying to lay the groundwork for their career, would you say that you found that partnership? Do you think it was luck? Were you introduced to someone at Emory? How did you land on a partnership that was such
Yeah. So I guess some of it was luck in the sense that the personalities were similarly interested in the same goal, right? But many of these partnerships come out of serious work, and it has been a labor of love, right? Because even though I saw the value of it, and my REI colleagues saw the value of it, the institution didn't always see the value of it. So we had to really work at building a clinic and building a partnership that we felt not only helped our patients, but also our trainees, our staff, ourselves. And we had to make a case for it to Emory healthcare system.
Yeah.
And, we were fortunate that we had the support of our department chairs and senior leaders in Emory Healthcare to make it happen. And um, I think it has been the number one reason that has kept me at Emory is my day-to-day clinical work and the fulfillment that I get with working alongside my REI colleagues.
That's lovely. So speaking of day to day, what does a typical day or week look like for you?
Yeah, that's a great question. So I have clinic where I see outpatients. I would say a couple of days a week or 2 full days a week. I have a day of procedures or operative cases, and then perhaps a half day of office-based procedures. And then I'm also residency program director for the Department of Urology. So I have some time protected for organizing our educational mission across the residency training program, but also for our medical students and our fellows and our APP fellows. So
Okay.
I find that really rewarding as well.
I can imagine, yeah, to get to sort of help the next generation kind of come in. Okay, so what part of your job feels the most meaningful or motivating right now of all the things that we just talked about?
Yeah, honestly, Chalice, I think it's the combination of things, and one thing feeds into another. So part of our clinical collaboration has also led to research pursuits and research ideas that we have been able to work on together. That is urology and REI. And then from the education sphere, training the next generation of physicians for me has always been very attractive. That's what brought me into academic medicine and has kept me here. So, watching our medical students and residents and fellows come into their own and go on to develop successful careers of their own is super rewarding as well. I don't know that it's one particular thing. I think it truly is the balance of like everything together.
I can see that truly the opportunity to grow and the opportunity to help
Yes.
like spread that growth towards others, towards, yeah, I can see that. So what are some of the biggest challenges that you face in your role and how have you learned to navigate them?
Yeah, I think, from an operational standpoint, reproductive health is a small part of a very big healthcare enterprise. So, um, figuring out where our clinics, our mission fits in within the bigger academic health enterprise, I think is always something that we are trying to push and promote. A few years ago, we made a concerted effort to start a fertility preservation program for our cancer patients, which was a heavy lift. It's not something that had existed at Emory before in an organized fashion, and it has taken a few years to get off the ground. And we are just now, a few years later, at a place where we can say, okay, we have a well oiled machine and process by which we are helping our cancer patients preserve their fertility for the future.
Yeah.
But, constantly reminded that when you build a program with one specific intention, often that has ripple effects and benefits for other things, right? So it started off with oncofertility, but it has really expanded to other patient populations who are also trying to preserve fertility for the future. And I think you always kind of have to keep your mind on that long-term prize in addition to the day-to-day struggles, because we can have so much positive impact by just thinking of like the multitude of ways that our day-to-day clinical services affect the people around us and the patients that we're caring for.
Yeah. So how do you maintain a healthy balance of just you protect your mental space when you're doing such big work?
Yeah, I think it's easy to get frustrated, particularly in the current, social political environment. And every time a big change happens, it's easy to get demoralized and angry and maybe miss your focus a little bit. But if you really think about the individual patients that you are helping every day or the individual trainees that you're training every day and how much even that one person can benefit from the care or the expertise that you're providing. That to me is very grounding. When I think about my day at the end of the day, what did I do today? What did I accomplish today? How did I help somebody today? I think that's very helpful to me. I think in academic medicine, we have this wonderful additional impact that we sometimes don't think about through our trainees, right? So we are obviously educating one resident, one fellow, one medical student, but in their career, they are going to help so many other patients and trainees of their own. So through that one interaction, you've really multiplied your efforts for future interactions, which is very awe-inspiring if you think about it. And that kind of keeps me going.
Yeah, I can imagine. And that's such an intimate part of people's lives, your reproductive health, and to be able to make it, especially for men, especially to be able to make a difference for them.
Yeah.
Yeah, that's really encouraging. So, what would you say are some misconceptions about your field that people might have, or your career path, or your area?
Yeah, so I think we are still a rarity in terms of urologists who specialize in male reproductive health, right? Compared to the number of REIs, male reproductive urologists are few and far between. It's not a field that's well recognized or well understood by those outside of OBGYN and outside of urology.
Mm.
So many times, patients don't know who to see, or physicians don't know who to send their patients to. So I think greater awareness of our field is still a challenge that we are overcoming. We take really excellent care of our patients. We're often working in close partnership with our REI and OBGYN colleagues. And I think sometimes the impact of that partnership is underappreciated. So that's another thing to remember. And the path into urology, so urology is already a pretty small field, and then male reproductive medicine is an even smaller subspecialty within that. And for trainees who are thinking of this career path, I think thinking broadly in terms of reproductive health, in terms of surgical profession and surgical expertise, and somebody who's interested in research, like those are all the things about our field that are attractive to future trainees. I would really encourage medical students in particular to come to this with an open mind. Hopefully, I've been able to convert many students and residents down this path, but I want to keep doing more of that.
Yeah, there's no doubt that you're having influence on someone. Somewhere is being influenced by what you've done. So, there was one more question about specifically towards, how have professional networks, mentors, or no, professional organizations, mentors, or networks supported your career development?
Yeah, that's a great question. And I think for those of us who are male reproductive specialists, we usually belong to two main organizations. We may have others as well, but our two organizations of interest are AUA, American Urologic Association, and ASRM. And AUA is our parent association that all urologists belong to, and we need for our professional accreditation and keeping up with changes in urologic expertise and urologic knowledge. But ASRM is really the place where most of us expand and broaden our careers, because this is the community where we have like-minded individuals who, like I said earlier, are all rowing in the same direction, right? So many of us find that our tight network of colleagues really comes from ASRM and SMRU and the affiliate organizations that fall under the ASRM umbrella. And we can take those partnerships to AUA or other professional networks, or create new partnerships through these relationships, institutionally or between institutions. And it really fosters, great friendship and camaraderie to be able to come to the ASRM Congress year after year, see the same people year after year, share knowledge, come up with research questions, serve on the same committees, and move the mission forward. So for me, I think ASRM has been integral for my career in a different way than the AUA has been.
Yeah, that's really encouraging to hear. That makes me very happy. So, what is one piece of advice that you wish that you had earlier, that you had heard earlier in your career,
Oh, that's a good one. Piece of advice that I had heard earlier.
or that you heard at just the right time?
Yeah, so I would say yes. So just the right time, the piece of advice was um, have multiple mentors or seek multiple mentors and really focus on building a mentorship team rather than identifying one or two like great mentors, because we all do so many things in our roles and we have needs that no one person can really address, right? There was a time in medicine where you looked to mentors and wanted to follow exactly in their footsteps. But that time doesn't exist anymore. Like our lives are very complicated and there's so much diversity in medicine, which is a great thing. So you really want to build your mentorship team to address the needs that you have. And some of them may be clinical needs, some of them may be professional development, some of it may be feedback, some of it may be how do I get plugged into like the research enterprise or the academic or teaching enterprise. And the more people you can have on your team, the stronger you are. So I'd really encourage people to look beyond and think beyond the most obvious contacts, right? So joining ASRM, I've really met a lot of people who are not urologists but have a role in the reproductive health space. And I've learned so much from them, much more than I could have learned just from my urology colleagues. And I would really encourage our younger members to do that.
Yeah, that's such good advice. Well, Dr. Mehta, thank you.
You're welcome.
Yeah, that was such a well-rounded explanation of some of the fulfilling parts that can come from a career, getting a chance to grow, getting a chance to collaborate. Um, we talked about a lot of things, so we appreciate you spending time with us today.
Yeah, of course. My pleasure.